They're gory, but they might be pretty effective.
When you have a hole in your neck, don't face the shower head.
This Tips from Former Smokers ad, and many others like it, was part of the first federally funded national anti-smoking effort. U.S. health officials say the images in the graphic anti-smoking campaign have persuaded 1.6 million people to attempt quitting cigarettes. According to the Centers for Disease Control and Prevention, personal efforts to stop smoking rose 12% after the ads aired on national cable and local television channels last year. By the end of the first 3-month ad run, 220,000 of those who tried to quit reportedly remained non-smokers. At least 100,000 of those smokers successfully quit altogether, which is twice the number CDC officials had anticipated. Local anti-smoking ad campaigns in New York, California, and Massachusetts, as well as one in Australia, helped the CDC determine which tactics work best to get smokers' attention. The conclusion? Focusing on the efforts of smoking-related diseases rather than the overall risk of death has greater impact. The national campaign cost $54 million, mostly funded by the Affordable Care Act. The CDC has run anti-smoking public announcements in the past, but as Bloomberg reports, major ad buys had been largely left to private groups, most notably the award-winning American Legacy Foundation's Truth Campaign in the early 2000s. That national campaign was funded by the master settlement agreement reached after states sued tobacco companies. And the CDC says while the multi-million-dollar campaign may have been a risky move initially, the ads will pay for themselves in a few years by reducing healthcare costs if they continue being this successful.
1/3 to 500,000 years of extra life have been added for the people that quit.
On average, smokers who quit cost $1,000 less to take care of each year than people who still smoke.
And according to USA Today, the ad model could be extended internationally, helping middle and low-income countries that are facing similar tobacco epidemics like China, India, Indonesia, and Russia. The CDC plans on continuing the TIPS campaign. Research on its effectiveness was published in The Lancet Medical Journal. For Newsy, I'm Christina Hartman.